Center Test Prep Exam Book 2. Question 1. Necrotizing fasciitis requires what priority treatment? Option A. Broad-spectrum antibiotics alone. Option B. Immediate surgical debridement. Option C. Hyperbaric oxygen therapy. Option D. Wound vac placement. The correct answer is option B. Immediate surgical debridement. Necrotizing fasciitis is a rapidly progressive soft tissue infection requiring aggressive, emergent surgical debridement of all necrotic tissue. Antibiotics alone are insufficient. Question 2. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A. Patch both eyes. Option B. Immediate copious irrigation with water or normal saline. Option C. Administer topical antibiotic drops. Option D. Perform a visual acuity test. The correct answer is option B. Immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 3. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A. Abdominal X-ray. Option B. Abdominal ultrasound. Option C. CT scan of the abdomen. Option D. Complete blood count. The correct answer is option C. CT scan of the abdomen. CT scan of the abdomen with for contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 4. Which laboratory value is most indicative of acute kidney injury? Option A. Elevated white blood cell count. Option B. Elevated creatinine and BUN. Option C. Decreased platelet count. Option D. Elevated liver enzymes. The correct answer is option B. Elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 5. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A. Pulmonary fibrosis. Option B. Right ventricular failure. Option C. Left ventricular hypertrophy. Option D. atelectasis. The correct answer is option B. Right ventricular failure. A massive pulmonary embolism increases pulmonary vascular resistance, which can cause acute right ventricular strain and failure, acute cor pulmonale, due to the increased afterload on the right ventricle. Question 6. A patient with a Le Fort 3 fracture is at highest risk for: Option A. Dental malocclusion. Option B. Airway compromise. Option C. Corneal abrasion. Option D. Temporomandibular joint dysfunction. The correct answer is option B. Airway compromise. A Le Fort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 7. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 8. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 9. A high femur involves: Option A, retinal detachment. Option B, blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. A hyphema is a collection of blood in the anterior chamber of the eye, usually from blunt trauma. The patient is at risk for rebleeding and elevated intraocular pressure. Question 10. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with Option A scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Blowout fractures of the orbit involve the thin bones of the orbital floor or medial wall and often involve entrapment of extraocular muscles or injury to the globe itself. Question 11. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mm Hg and in the left arm is 130/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 12. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, immediate endotracheal intubation. Option D, neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. A GCS of 8 or less indicates severe brain injury and an inability to protect the airway. The patient should be intubated for airway protection. Question 13. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Some chronic CO2 retainers rely on the hypoxic drive as their primary respiratory stimulus. Oxygen therapy in these patients should be titrated carefully to maintain SpO2 between 88 to 92% to avoid blunting this drive. Question 14. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A, obtain a stat chest X-ray. Option B, needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 15. The best method to remove a prosthetic eye in an emergency is Option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue. Question 16. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A, ESI level 1, Option B, ESI level 2, Option C, ESI level 3, Option D, ESI level 4. The correct answer is Option A, ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. An altered mental status with severe respiratory depression requires immediate intervention, making this a level 1, most acute. Question 17. A patient with suspected bowel perforation should have which initial diagnostic study? Option A, CT scan with contrast. Option B, abdominal ultrasound. Option C, upright chest X-ray. Option D, colonoscopy. The correct answer is option C, upright chest X-ray. An upright chest X-ray, or left lateral decubitus abdominal film, is the initial screening test for free air under the diaphragm, indicating a perforated viscus. Question 18. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner sign, option B, Cullen sign, option C, Murphy's sign, option D, Vrofsing sign. The correct answer is option B, Cullen sign. Cullen sign, periumbilical ecchymosis, and Gray-Turner sign, flank ecchymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 19. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. The protective effects of hypothermia reduce cerebral metabolic rate and oxygen demand, which can allow for survival and neurological recovery even after prolonged submersion. Question 20. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Pulsus paradoxus, an exaggerated decrease in systolic blood pressure, 10 mmHg, during inspiration, is a hallmark finding in cardiac tamponade and is also seen in severe asthma and COPD exacerbations. Question 21. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, dry skin and absent bowel sounds. Option C, hyperflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperflexia, clonus, and agitation. Serotonin syndrome results from excess serotonin and presents with a classic triad of mental status changes, agitation, autonomic instability, and neuromuscular hyperactivity, hyperflexia, clonus, rigidity. Question 22. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, CSF leak, rhinorrhea. Option D, sinus infection. The correct answer is option C, CSF leak, rhinorrhea. The presence of glucose in clear nasal drainage after head trauma confirms a CSF leak because CSF contains glucose, while normal nasal secretions do not. This is associated with a dural tear. Question 23. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 24. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer. Option A, folic acid. Option B, vitamin B12. Option C, thymine. Option D, magnesium sulfate. The correct answer is option C, thymine. Wernicke's encephalopathy is caused by thymine, vitamin B1, deficiency, common in chronic alcoholics. Thymine must be administered before or with glucose to prevent precipitating or worsening the condition. Question 25. The safe harbor provision for nurses typically refers to option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation.